All right. Hello, Mr. Adebola. My name is Queen. I'm an NP student. We're going to be doing a musculoskeletal assessment today. And I want you to give me the consent to be able to do the assessment, post it on YouTube for my instructor to review and grade it. Is that okay with you?
Yes, ma'am.
Okay. So we're going to be doing a musculoskeletal assessment from your neck all the way down. And I'm going to be adjusting the video so that my instructor can see exactly what I'm doing. Okay. All right, so first we're going to be starting with we're going to first of all inspect and then assess your fingers and your wrist, okay? So I want to go ahead and take a look at your fingers here. Adjust this video. Okay. All right, so I'm looking at your fingers. There's no nodules. There's no deformities noted to his fingers and to his wrist. And no deformities, no lumps. And palpating it, do you feel any pain? Mm-hmm. And I'm also going to be feeling his ulnar and his radial bones here. And I don't see any bony prominences. There's no inflammation. There's no redness noted. So second of all, we're going to also be doing the extension and the flexion. So I want you to do your hands up and down. That's good. And do it side to side if you can. Okay. So next that's fine. So next I'm going to have you spread out your fingers. Do you feel any pain?
No.
Okay. And then I'm going to palpate your nut box, which is on the upper side of your thumb. Your nut box is this one, nut box. Do you feel any pain?
No.
Okay. All right. So next, I'm gonna palpate the tonal panel. Okay. Do you feel any pain?
No.
Okay, so next thing I'm gonna do is for you to put your hands together like this. You can, like this.
Okay.
Is that? And hold it on like that for like 10 seconds. Press it down together. Do you feel any pain?
No.
Okay, so that's good. Was there any numbness when you were doing that?
No.
No? Okay, so that's good. All right, so now we're going to do the median compression test. So what I'm going to do is to compress your nut box here, basically here. And so I'm going to compress it and see. Let me know if you feel any numbness to it.
No.
Okay. And then we're going to do this one too. Let me know if you feel any numbness to it.
No.
Okay. All right, next we're going to be doing the synclitin test. So what I'm going to do is to make a fist with your hands fisted into your arms. Okay. So you hold it that way. And then, and I'm going to be extending. And let me know if you feel any pain when I do that.
No pain.
So I'm going to be extending it, flexing it. No pain?
No pain.
Okay. And we'll do the same for this one. Let me know if you feel any pain.
No pain.
Okay, so that's good. All right. So next we're going to be doing the Fehling test. The Fehling test is to check for vascular flow to the hands. And what I'm going to do is I'm going to have you make a fist of your hands. Just one hand. We'll do one hand at a time. And then I'm going to be occluding the ulnar arteries. Then go ahead and open your hands for me. And you see that your palm is kind of white. So basically because I already occluded the blood flow to that palms. So I'm going to release one. And you see how it turned back pink. Did you see that?
Yeah.
Okay. All right. Let's do that for the other hand. So with your fist, I'm gonna occlude the ulnar arteries, and then open. See how wide it is?
Mm-hmm.
And then I'm gonna release one. See how pink it is? And then I'm gonna do the other one. And then occlude it again, we'll do it for the other artery. Just one hand at a time. So I'm gonna occlude this, and I'm gonna open your ends for me. See it's white? And then I'm gonna let go, you see? Did you see it? It's back pink. Alright, so that's good. So then we're gonna be doing the medial and the lateral. No, we're gonna be doing the elbow test, okay? So we're gonna inspect your elbows. There's no deformities to the bony prominences. There's no inflammation. There's no redness noted. Elbows appears normal. No tenderness noted to the elbows. Then I'm gonna be checking the medial and the lateral epicondyle, okay? So which is here. Any pain?
No.
And let's do it for the other one. Any pain?
No.
All right, so go ahead and move the elbow for me down, and then do the pronation and the supination. That's good. So let's do it for the other arm. Okay, so pronation and the supination, and flex it, extend it. Okay, that's good. So now we're gonna do the shoulder, okay? So I'm looking at his shoulders. His shoulders appears normal. There's no deformities, there's no tenderness. Do you feel any pain to it?
No.
There's no deformities, there's no swelling, there's no inflammation noted. And I'm gonna go ahead and palpate the clavicle to the acromion, which is this bone here. And then I'm gonna palpate this one as well, which is the clavicle acromion. And do you feel any pain?
No.
Okay. All right. So next, I will need you to scoop up out a little bit. Yeah, that's better. Okay. So what we're gonna do next is to check the deltopectoral groove. And do you feel any tenderness there?
No.
And we'll feel the deltoid pectoral groove here, which is the notch of the shoulder. Then to the bicycle groove. Okay. So what I'm gonna do, I'm gonna have you do range of motion. You'll do the abduct, which is to raise your hands up.
Why sitting?
Yes. And then you adduct back to you. And try to, if you want to stand up and do it, then that's fine. But let me make sure the video is gonna take down. All right, so you can pull. Okay, and then your hands backwards you can, and then forward, and then up, and sideways, and down. Did you feel any pain when you did all that?
No.
Okay, that's good. Okay. Okay, so that's good. So he has a full range of motions to the shoulder with flexion, extension, abduction, and adduct. So that's good. Okay, so now we're gonna be doing the onion arm test. Okay. So what I'm gonna do is I'm gonna pull hand forward to touch the opposite shoulder. So what I'm gonna have you do is to use this hand to touch the opposite shoulder. And what we're doing is to make sure that there's no pain to this bone here. Do you feel any pain?
No.
Okay. So go ahead and do the same for this arm. Okay. And do you feel any pain?
No.
Okay. All right, so that's good. All right, so we're gonna do the internal and the external rotation. So what I'm gonna have you do is to see if you can touch the back of your head. So you're gonna use this arm, or since this arm is like that, use it to touch the back of your head, okay? With your head straight. Okay, that's good. Do you feel any pain?
No.
All right, so go ahead and do the same for this hand. And do you feel any pain?
No.
Okay. All right, so that's good. So the next attempt is we're gonna do the speed test. So I'm gonna have you fist your hands facing upward, and then push against. I'm gonna push against resistance. Okay.
Okay.
Let's see. Okay. Alrighty, so that's good. And we're gonna do the next test. So the next test is that I'm gonna press down on your scapular, on the back, and then I'm gonna have you pronate your hand and see if you can touch that. So what I'm gonna do is to have you touch this blade here.
Which one?
Okay.
Which one?
With your, use this hand to touch this blade here. Okay? All right. And then try to use the other hand to touch the blade of your shoulder. Okay? Okay, that's good. And then we're gonna do the Hawking test. Okay? So the Hawking test is that I'm gonna have your hand halfway like this. So like this. Okay. And then flex your elbow. No, like this. Then let me see. Like this. Okay? And flex it down. Okay? And move it backwards and forward. Do you feel any pain doing that?
No.
Hmm?
No.
Okay. All right. So that's good. And then we're gonna so what we're gonna do is to do the apprehension test. And what I'm gonna do is I'm gonna have to hyperextend the shoulder, okay? So I'm gonna have your hands like this, a little bit lower. Okay, scoop out a little bit for me. Okay, and then while your hand is like that, and I'm gonna over rotate your shoulder. Let me know if you feel any pain while I'm doing that. Any pain?
No.
Okay. All right, let's do the same for the other hand. I'm gonna have you flex your muscles, and I'm gonna hyper rotate it. And let me know if you feel any pain. Any pain?
No.
Okay. All right, so that's good. So the next is to do the drop arm sign. So I'm gonna have you flex your arms down like this, okay? And then I'm gonna have you abduct your arm upwards. Okay. So you abduct it upwards. And then try bringing it down slowly, like slowly. Okay. Then all the way down. Okay, that's good. So you didn't kind of, there's no like neurological or deformities noted, because sometimes when there's a deformity, the hand just kind of drops down very fast. So that's good. So next we're gonna be doing your neck. And I'm looking at your neck. I'm looking for symmetrical. And your neck is symmetrical. Your trachea is midline. No deformities noted, no deviation noted. So now I'm gonna palpate your neck and see. Let me know if you feel any pain, okay? Any pain?
No.
Okay. So now I'm gonna have you move your neck up and down.
That's more
Move your neck up and down, down, and side to the other side. Okay. Any pain?
No.
Okay. So I'm gonna have you use this ear to touch the shoulder, and I want you to do it on both sides. So use your ears to touch your shoulder, okay? And do the same for the other ears. Okay, that's good. So the next, now we're gonna be doing your spine, okay? So I'm gonna have to adjust the camera. All right, so I'm gonna have you stand up for me. Okay. All right. So what we're gonna do here, so I'm looking at your spine. It's symmetrical. There's no deviation. Posture is upright. No deviation, no inflammation noted. So what I'm gonna do is I'm gonna have you take your hands off your pocket, and I'm looking at your curvature. Your curvature is symmetrical, okay? So what you're gonna do is, on your spine, I want you to kind of go down, and your spine is concaved, okay? So what I'm gonna do is, I'm gonna palpate your spine from C7 down to the tailbone, and let me know if you feel any pain on palpation, okay?
No.
Any pain?
No.
Okay. All right. So what I'm gonna have you do is to bend and touch your toes. And what I'm doing here is to assess for scoliosis, okay? And I'm looking at the spine is kind of concave. It's C shape. There's no deformities. There's no noted scoliosis noted. Okay, you can stand up. All right. So while you're still, go ahead and bend one more time for me. And I'm gonna place my hand on your hip, okay? And what I'm doing is I'm assessing for discrepancies, and I see that your hip is aligned. And next, I'm gonna have you stand upright and flex your back for me. Like, you move it, and then you bend to the side, bend to the other side. Okay. Bend towards the left and right downwards again. Okay, that's good. So the next, we're gonna be doing your hips, and on this one, I'm gonna have you lay down, okay? I'm gonna adjust the camera here. Yes, I'm gonna have you lay down. No, you're gonna lay down. Okay. So now I'm gonna have you lay down on your back, and as you're laying down on your back, I'm gonna have you flex your legs, okay? Hold on, I'm gonna have to adjust this. Okay. So I'm gonna have you flex your leg up. Let me know how far you can go. Stretch this knee.
That's it.
Okay. All right.
That's it.
Okay. All right. So we have to do the flexion and the extension. So what I'm gonna have to have you do is to lay on your tummy. And then I'm gonna flex this. Okay? And then we'll flex the other one backwards. Okay? All right, so that's good. So now, and now I'm gonna have you lay on your, I'm gonna have you lay on your side so that we can do the abduct and the adduction, okay? So lay on your side for me. Okay. Do them stretched out. Okay. And then the adduction, we'll do it this way. Okay. So I'm gonna have you lay on your other side. You might have to put your head on this side so that. Okay. So I'm gonna have you lay on your side, and then we'll do the abduction and adduction. Okay. All right, that's good. So so we've done the adduction and the abduction, and then we'll
Nice that.
and we already assessed the internal and the external rotation. Okay. So now, while lay on your side with your head that way, if you don't mind. All right. So what I'm gonna be doing next now is I'm gonna be palpating your greater trunci. Okay. So this is to palpate the bone of your hip. So I need you to, can you keep your legs straight up a little bit? All right. So the greater trunci is this trunk here, is this one here. And do you feel any pain or tenderness? Noted. Okay. So no pain, no tenderness noted. And then next, I'm gonna be palpating the synovial notch, and which is the bone here, the bone, which is the bone on his bottom, pretty much the butt bone. And do you feel any pain? Okay. All right. So now I'm gonna have you lay on the other side so I can also palpate the greater trunci and the synovial notch. All right. So do you feel any pain or any tenderness? All right. And then the synovial notch is the bone of the butt. Do you feel any pain or any tenderness? Okay. All right. So that's good. So now we're gonna palpate the sacroiliac joint, which is gonna be the one at the hip bone, pretty much. Okay. So I'm gonna have you turn around for me here, and is this notch right here? And do you feel any pain, any tenderness?
No.
And there's no pain, no inflammation, no edema, and no tenderness noted. And bone area is symmetrical. Okay. So next we're going to be doing the straight leg test, okay? So I'm going to have you lay on your back for me. And then I'm going to have you raise your leg the highest that you can.
Two?
No, we can do it one leg at a time. That's fine. You have to do it slowly.
Easy.
Okay? All right, so we'll do it for the other leg. Straight that knee. And let me see how high you can go. And that's it? Okay. All right, and that's a straight leg test. So now you can sit up for me. And we're going to be doing your knee. All right, so we adjust this. Okay. All right. So I'm looking at his knee. There's no swelling. There's no inflammation. Can it go up or no? Okay. Okay. So looking at his knee, There's no inflammation, there's no redness, there's no swelling noted to the knees. Knees appear symmetrical, skin is warm to touch. No deformities noted to bony prominences. So what I'm gonna do next is I'm gonna go ahead and palpate the knees and let me know if you feel any pain upon palpation, okay? Any pain?
No.
And any pain?
No.
Okay. All right. So no pain noted. So next I'm gonna be palpating the tibial tuberosity, which is the bone of the kneecap. Okay. So I'm palpating the tibial tuberosity, and it's symmetrical. There's no bulging. There's no edema. There's no inflammation noted. Do you feel any pain?
No.
Okay. All right. So next, I'm gonna palpate the meniscal groove, and I'm assessing both the lateral and the medial side of the meniscal groove. Okay. So the meniscal groove is the bone on the side here, and the lateral. Any tenderness? Any pain?
No.
Okay. And it's symmetrical. No edema noted, no swelling, no inflammation noted. All right. So next, I'm gonna have you stand up for me. All right. So you turn around for me. So what I'm trying to, I'm gonna be assessing the, I'm gonna be assessing and palpating the back of your knee, okay, your patella, the back of your patella, and I want you to let me know, do you feel any pain?
No.
And no edema noted, no inflammation, symmetrical.
No.
Okay. So what we're gonna do next is, you can stand the way you're standing. Make sure this, okay. So what I'm gonna do is I'm gonna have you flex your knee for me, okay? So you flex it up and down. Then you do you abduct away from your body. You abduct like this away. No, your knee, this one.
Okay.
You can do it from the side, okay? And back, and do the other leg, okay? And back, okay. So then I'm gonna have you lay down again.
In my back.
Okay. So now that you're laying down, I'm gonna be checking for the venous and the vagal stress testing. Okay. So now what I'm gonna be doing is to check the meniscus, and I'll place hand on the knee and on the other leg and lift it from the ankle and move the leg from side to side. Okay. Okay, then we'll do the same for the other one. Flex it here. Flex it here. Okay. All right. So now, so next is that I'm gonna do the ankle, and I'm gonna move the leg from side to side, okay? And then and I want you to let me know if you feel any pain when I'm doing it. Let me see. Camera seeing that. Okay. Any pain?
No.
Okay. Okay. All right. So next we're gonna do the Lockman test, okay? So I'm gonna have you flex your knee and extend your legs. So you're gonna do this. Okay. So extend your leg and see. Do you have any pain?
No.
Okay. And we'll do the same for the other leg. Any pain?
No.
Okay. All right. So now we're gonna do the medial and the meniscus injury test. So I'm gonna have you extend your knee, and then I'm gonna use my hand to support the back of the knee, okay? And then the other hand to hold the sole of your feet. All right. So I need you to extend your knee for me. Any pain?
No.
All right, so we'll do the same for the other one. Go ahead and extend it. Any pain?
No.
Okay. All right.
How big this go? It's possible.
Okay. All right. Any pain?
No.
Almost done. Any pain?
No.
Okay. Okay. So the next one is the knee effusion test. So what I'm gonna do is I'm gonna push down on your patella and ask if you feel any pain. Okay?
Okay.
Any pain?
No.
Any pain?
No.
Okay, that's good. So the next I'm gonna be doing is the patellofemoral syndrome test. And with this one, with you still laying down, I'm gonna push side to side on the patella, and I'm gonna be pressing it down while I'm pushing it from side to side, okay?
Okay. What is paragraph?
Any pain?
No.
Any pain?
No. Yeah, Gaga.
Any pain?
No.
And any pain?
No.
Okay. All right. So during that test, I was feeling for capitals of the knee and the joint, okay? So now we're gonna do the ankle and the feet. All right. So the ankle and the feet is I'm gonna have you sit down. Okay, sit up. Can you sit in the middle instead of sitting all the way there? All right. Let's go adjust this one. So. Okay, good. All right. So I'm looking at his foot and his ankle. I'm inspecting for redness. No inflammation, no redness, no tenderness, no deformities noted, appears normal. bilateral feet and ankle is symmetrical. So now I'm gonna go ahead and palpate the feet and the leg, and then let me know if you feel any pain. Okay. Any pain?
No.
Any pain?
No.
All right, so we'll do the same for the other one. Do you feel any pain?
No.
Okay. All right. So next, I'm gonna palpate the lateral malleosis and the medial malleosis, which is this notch here. Okay. Do you feel any pain?
No, man.
Okay. And I'll do the same for the other leg. Do you feel any pain? And no pain, no tenderness, no deformities noted. So now I'm gonna be palpating the calcaneus. And palpate the heel bone. Any tenderness?
No.
Okay. And I'm gonna palpate the metatarsals. Any pain?
No.
And I'm gonna palpate the DIP and the PIP bones. Any pain?
No.
And no pain, no swelling, no swelling noted. And I'll do the same for the other leg. I'll palpate the calcaneus, palpate the heel bone. Any pain?
No.
And I'll palpate the metatarsals, the DIP and the PIP bones, and no swelling, no inflammation, no redness noted, and it's symmetrical. So now I'm gonna have you do kind of flex your foot for me and try and move it from side to side, and do the same for the other leg, and do it from side to side, abduct and adduction. And then rotate your legs around, your foot around, like rotate it. That's good. And then rotate the other one for me. Okay. And I want you to do like the up and down, like abduct, abduct, abduct. No, your feet, just like that. Okay, that's good. Any pain while you do that?
No.
Okay. And the other one? Any pain while you do that?
No.
Okay, that's good. And that concludes the assessment for the musculoskeletal system. And thank you.